So, what's your name?
So my name is Katrina. I am healthcare assistant and I'm also Unison rep. That's
Christine, and I'm also a healthcare assistant.
I see.
Rachel.
So, why are you protesting today?
so today we are on the strike action in 5 hospitals, three trusts, Kettering, Northampton, and here in the Leicester. We are low-paid healthcare support workers. What happened for many years? The hospital were paid us as the band 2. We were doing a task like ECG, cannulation, bladder scanner. We were collecting the medication from the pharmacy. We work as the nurses, as the qualified nurses, but they paid us as the band 2, the same pay as the housekeepers and the porters. We were carrying on very high qualified tasks, but they didn't pay us correctly. So we started the grievance with the Unison. We decide that we want to start the strike action because the hospital refused to pay us. They owed us the money for the 6 years for all of the tasks what we were doing above our qualification.
Right.
So we were doing things above our qualification, but we have been underpaid. So they have our money, they have to pay us the back pay. This has been discussed in the parliament. They know that they have to pay us. There was the whole committee, the shadow healthcare committee. They decide that this is necessary for us to be on the proper band, on the band 3. They recognize that we have been unpaid for a year. They recognize that every trust has to pay us, but our trust refused to pay. What they proposed us is only 2 years and 7 months, and they don't want to pay anything for the bank staff. So we have around 500 bank staff who also work as the band 3, but they get paid as the band 2. But the hospital don't recognize the bank staff. They don't want to pay us 6 years, they only want to give us 2 years. So we are in current dispute with the hospital. They refuse to negotiate with us. They recently, after I think a year, they placed us on the band 3, but we're still fighting for the back pay because we say we worked through the pandemic. We risk our life. We have been here all the time. We doing most of the patient care, most of the clinical tasks. The nurses are always busy. They barely help us sometimes. We are left all alone.
The thing is, though, it's all to do with the agenda for change. So when they brought the agenda for change in, I can't remember what year that was.
Yeah,
but it's many years ago, further back than we're trying to claim for. These tasks should have been being paid for right back then, and then not. It's only this year that they've decided that the government decided that we.
Because the band 2 it's only personal care. So we're supposed to only look after the patient. We should never do any clinical task as the band 2. But we were carrying on this for a year. They were giving us extra tasks all the time, on and on, to the point that we sometimes work more than the nurses. Sometimes we were working more than the doctors, because doctors even don't know how to do the ECG. Some of the nurses, they don't know how to do the ECG, but we were doing ECG. So we were
Technically, is that an extra job?
It is.
It's all extra.
Yes.
Anything from anything on
Personal
top of personal care.
So more work
It's
for you.
classed as extra tasks, and we should have been paid for it.
Yeah.
So like even down to a blood pressure, it's classed as a band 3
Exactly.
role. But people coming into the trust are coming in doing blood pressures.
Yeah, we're doing the observation all the time, sepsis screening all the time. We're checking blood pressure, heart rate, respiration. This is the sepsis screening. This is very important.
Very important.
And this is the clinical task. This is the band 3. We should just do the personal care, and that's it.
So, what's your message for the government?
The message for the government is
First of all, we need more funding.
Make our trust pay us what they owe us.
Exactly. We need more funding because we know that the NHS is struggling. The waiting lists are too long. There is an extra pressure on the NHS. There is not enough nurses and there is not enough staff, but they don't hire more. They stop recruiting. They want hospital save the money, so now the bank staff, they don't have that. There is no overtime, there is no bank staff, there is no recruitment. We are understaffed.
So less staff.
Yeah, there is a less staff.
because they've
That's-
stopped bank staff
Yes,
from
they're
working.
saving a money. They're saving a money. They don't recruit the new staff. There is not enough staff. That's why we're doing those clinical stuff, because they put, instead of hiring new nurses, they just put those tasks on us. So we want more staff. We know that we are heavily understaffed. We need the
Fairly
funding.
pay.
Yes, we need the funding. We need the more money. The conservatives, if I can be honestly, conservatives, they constantly pay us the same. They don't recognize inflation. We have inflation, so the funding should be higher, but they keep it at the same level. This is
But
unacceptable.
Even on
And
a
we-
personal level, though,
Yeah,
we
and-
haven't been given our pay rise yet.
Exactly,
This year.
in
They
April.
haven't.
Yes,
they
they
haven't
didn't.
told us what we're going to be getting.
Exactly.
And we're meant to have it from the start of the new financial year.
That's
And
absolutely.
it's
That's
not-
yeah. Our pay should be reviewed on April, on 1st of the April.
Yeah, but that's
It
when we should
didn't.
get
It didn't happen. So we don't have any pay rise at the moment. Everyone gets it, but the public service we didn't get any pay rise. The conservatives, they basically pretend that the NHS it's fine, that we don't need the pay rise. They don't need to review our pay. They don't give us any extra funding for the waiting list. And this is affecting us as the low-paid healthcare support workers, because we have a more job.
Thank you for all, and I hope the government will listen for your
Thank
message.
you.
Have a
Thank you
good
very
day.
much.
Bye bye.